Are you facing challenges in your health? Then Dr. Suleiman Clinic and Labs is here to provide you with the lasting solutions to your health problems. Dr. Suleiman Clinic and Labs is specialized and offers consulting in psychiatry, internal medicine, cardiology, urology, dermatology, gynecology, infectious diseases, and infertility. At Dr. Suleiman Clinic and Labs, we offer 3D/4D scan at just 5,000 francs, emergency ambulance, free ultrasound scan, and free medical consultations. Our staff is composed of well-trained doctors with good laboratory and best equipment. We are located in 2 cities, Boya at Mile 18 Bolifamba, and in Douala, we are located at Entre Pilot. You can reach us through the telephone number 694-940-172. Your health is at the right place with Dr. Suleiman.
If we're not going to take a break, let's talk about what are the danger signs and symptoms that you should look for when you are pregnant. First sign that you should be looking for when you have leakage of some clear fluids, leakage of some fluid from the vagina. You're not urinating, but you are leaking fluid from the vagina. This is a preterm delivery. That means the membrane has ruptured and now you have to run to the hospital, and I hope you are near term. I hope that you are near term and delivery hopefully will be successful. So you look for any leakage from the vagina, and this leakage most likely is the amniotic fluid, that the membrane has ruptured and now you see the leakage. Next thing you do, run to the nearby hospital, the hospital that you have arranged for your delivery. What else? A danger sign that you should be looking for: hyperemesis, meaning you want to vomit, or you are vomiting, or you are nauseated all the times. During the first trimester, it is normal to have a bit of nausea and a bit of vomiting that should disappear after the first trimester or so. If it persists, we have a problem. And if it becomes severe, we have a bigger problem. Early in the pregnancy, we know if it's a valid pregnancy or a molar pregnancy. Don't worry about the term molar pregnancy. Molar pregnancy is not a valid pregnancy. It's something else. It's a disease. So assuming it's a valid pregnancy and you have a lot of vomiting, hyperemesis, we have to look at the kidneys, because sometimes infection of the kidney can cause that severe hyperemesis or severe continuous nausea, vomiting all the times. If we have pain on urination, this is also a danger sign that you should be looking for. That means there is cystitis, there is possible pyelonephritis or infection to the kidney. If we feel, mothers know when the baby move, and they know the frequency of movement, they know. So when the baby is start of decreased movement, the baby is not moving as it used to be, as he or she used to be, then the mother would know, and that is something that you should immediately go for checkup, unless you are taking sedatives, like some mothers use drug abuse like heroin or so. If you use sedatives, any kind of sedatives as a drug abuse, obviously the baby will also be sedated. You're not the only one. Whatever the mother takes, the baby also is on. So if you're taking heroin or any illegal drug or any sedatives, you can expect the baby movement will also be less. Anything you take, the baby is also taking. If you take alcohol, the baby is also taking alcohol. So anything you take, the baby is also taken. If you feel uterine cramps, that means there is a preterm labor. Then you also have to rush to the hospital. And listen to this sign that I'm going to discuss now. If you feel at any given moment that you have a swelling face, a swelling hand, you're pregnant with a swelling face, a swelling hand. A swelling leg is normal in pregnancy because they always have swollen legs. But when you have swelling hands, that is not normal. When you have a swelling face, that is not normal. So in this case, you must go to the clinic or to the doctor or to the nearby hospital, and then they will check urine analysis to see if there is protein or not. We're going to discuss in details each one of those signs and see what does it mean and why we have them and how to avoid them. You know, I just want to share a story with you. You know how difficult for someone to get pregnant and how much stress, if you have an issue of infertility, you go through just to have a baby. Whether men or women, a lot of stress they go through, a lot of finance they lose on the spend to have a baby. Imagine now, on the other hand, somebody that got blessed with a baby and they want to lose this baby. They're not interested in having this baby. So what they do? They go for abortion. I'm going to share a story with you today, this evening, and I hope we'll learn from it. A few years back in Cameroon here, I had a situation about 2 o'clock in the morning. Somebody comes in with a young lady, 24 years old. And this young lady, she cannot walk, even though she is healthy. She has high fever. We take the blood pressure is very low. And she's been around to all centers, here and there, everybody, gastric. Nothing is resolved. So they come in, she was in a very bad shape. Her name was Brenda, I think, yes. So Brenda comes in. I asked Brenda, when was the last menses? Brenda said, oh, I just had my menses. Okay, Brenda, no problem. Lie down. Well, they carried her down on the bed. So I always do the ultrasound first thing. What the patient says something, and reality sometimes is totally something else. So the ultrasound shows a uterus that has remains of pregnancy. But this pregnancy was different. The skull is in one place. The bones of the hand is in one place. I'm saying bones. There is no flesh. On the bones was no flesh, just bones. The legs, so the baby was dismantled. All I see is bones, and all I see is very severe inflammation. Inside the uterus, in the walls of the uterus, around the uterus. So I go to Brenda, listen, you know that you're pregnant, or you were pregnant. No, I'm not. I said, listen, this is now between you and I. We see a baby, a dead baby, and this baby been dead for a very long time, at least a few months. Am I correct? Then she started to talk. She got pregnant. She didn't want the family to know that she's pregnant. She went God knows where in the bushes to somebody who gave her some alcohol, and with a stick aborted the baby. So she bled. She was bleeding. She thought this is it, this is the end of it, but it wasn't. Whoever did that was not a doctor, was not a medical staff. And the baby died, but all the bones, the skeleton of the baby was broken into pieces, so many pieces. And that's what I have seen. Of course, the baby got rotten inside, and it caused what is called endometritis, myometritis, parametritis. Those are medical terms. Basically, it means, in simple English, the whole uterus, from outside to inside to around the uterus, was severely infected, severely inflamed. That infection spread to the blood, and now she is very much in septic shock. So the diagnosis was septic abortion, done by non-medical staff. I'm against abortion, even if it's done by the best professor in the world. God gives you a baby, you keep that baby. And the funny thing is, the same patients that did abortion early in their life, they come to the clinic my clinic or any other hospitals. They want to get pregnant again. So you refuse what God gave you. I am not judging anybody, but I'm just giving an example from my experience that had happened, hoping that maybe one of us will learn not to do it. And at this time, I'll be saving one life that was about to be lost. So God blesses you with a baby. You go and abort, and then few years later, you are suffering infertility. You cannot have a baby, and you come because you want to have a baby. You rejected what God given you before, and now you want a baby? Well, we do mistakes in our life, but killing a soul, I don't think it's a simple mistake. It's a huge mistake. You know, and the mistake is even bigger when you hear the baby's heart. I am for abortion, and a lot of other doctors are for abortion if it is direct threat to the mother, and it's a big if. If the mother is about to lose her life because of the continuous pregnancy, then in this case, yes, we save the life of the mother, and she can always get pregnant again. So let me continue with what had happened in Brenda's case. We stabilized her on antibiotics. She was no longer febrile, and her blood pressure went up. But at the time, I don't have surgery room. I don't do surgery. I am not a surgeon. So I have to refer to a hospital where they can do the surgery. And exactly that's what I did. She walked into that hospital on her both feet. And 3 days later, she was supposed to come back, but she never did. Then the family called me and said, Brenda, no more. Brenda is gone. What happened? You know, in medicine, when things get infected, now we have a uterus that is fully infected. Yes, she was on antibiotics for a couple of days or so. Stabilized the situation. But the uterus is still infected and inflamed. And when you have a uterus that is infected and inflamed, and you want to do dilation curettage, take out all those remains of pregnancy out, the uterus is very fragile because it's infected and inflamed. So the chances of perforation of that uterus is very high. As I wasn't there in the surgery room, so I don't know, I cannot tell you. I'm assuming, based on my medical knowledge, that's what had happened, perforation of the uterus, because the uterus was inflamed because of that pregnancy that she kept inside of her for 4 months. What is the lesson learned? If God gives you a pregnancy, keep the pregnancy. You yourself, you will struggle later on in life to have a child, and maybe you won't be able to have one, because when you do abortion, it has its own complication, among which you go too deep, you cause calcification, you cause scarring, you cannot carry a pregnancy again. You cause scarring in the cervical canal, where the sperm has to go through, like we explained before. You cannot have a pregnancy. You cause scarring in the endometrium, where the baby has to live. The baby will drop because it cannot hold on to the walls of the uterus. So there's a lot of complication. So my advice is stay away from abortion and appreciate what God gives you. Do not throw it away. A lot of people are looking for babies. Why would you do an abortion and you come again later after a few years asking for a baby? You already had one and you rejected it. So please reconsider before you take that decision. Now, let's look about what should I be looking for if, let's say, I have threatened abortion. What is threatened? I didn't do any abortion, but I see blood coming out. I'm pregnant, and I see blood coming out, and I'm worried. I'm at 8 weeks, let's say, 9 weeks pregnancy, that is first term. And you see blood, vaginal blood. The first thing you will do is you're going to go to the clinic. The doctor there will open you up, or the midwife will open you up and see if the mouth of the uterus is open or closed, because it means a lot. If the mouth of the uterus, which we call the OS, is open, that means most likely the baby will drop. all abortions start with threatened abortion, whereas you're bleeding, but the mouth of the uterus is closed, the os is closed. It's just a matter of time that it progresses now from threatened abortion to inevitable to incomplete to complete abortion. It's just a matter of time. So what would you do if you are pregnant in the first trimester and you see vaginal bleeding and you went to the clinic and the nurse or the midwife told you that the mouth of the uterus is closed, the os is closed? You're going to do a lot of bed rest, okay? And hope that everything is okay. So a lot of bed rest, and we pray that the pregnancy continue to the second trimester. Once you get to the trimester and you fly, you will just fly through the second trimester and the third trimester. You will not even feel it. So the only difficult one is the first trimester. You make it through the first trimester, you made it through the whole pregnancy safely, inshallah. Okay, so this is abortion, and I already give you a life scenario, a life case about septic abortion, abortion that is done outside in the bushes. Sometimes it goes, and okay, there is no complication, you just got lucky, but most of the times it doesn't. So you don't want to be another Brenda in life.